violence. They can choose instead to behave non-violently and foster a relationship built on trust, honesty, fairness, and respect. The victim is never responsible for an abuser's behavior. Is it the behavior problem that causes domestic violence? Well, domestic violence against women by men is caused by the misuse of power and control with a context of male privilege. Male privilege operates on an individual and societal level to maintain a situation of male dominance, about which we have been talking throughout the discussion, where men have power over women and children. Perpetrators of domestic violence choose to behave abusively to get what they want and to gain control over their family. Is it the alcohol or drugs that causes domestic violence? The use or misuse of drugs is not the underlying cause of domestic violence. Many people who drink too much do not do domestic violence at home, and the people who may be violent are violent without the use of drugs or alcohol. So abusers who use drugs or alcohol as an excuse for their behavior, saying that, oh, I was drunk, I don't remember anything, that's wrong. Even if they genuinely do not remember what they did, it does not remove the responsibility for their behavior. Is it the lack of control that causes domestic violence? Domestic violence basically is about gaining control. It's not about the lack of control. If an abuser is careful about when, where, and to whom they are abusive to, then they are showing sufficient awareness and knowledge about their actions, and that indicates that they are not out of control. Is it the mental illness that causes domestic violence? The vast majority of people with mental health problems do not abuse other people. However, there are a small number of people who are in mental distress who may behave abusively, though this may not necessarily be caused by a mental health problem. If an abuser is careful about when, where, and to whom they are abusive, then they are showing sufficient awareness and knowledge about their actions. And it indicates that they are making choices about their behavior. If an abuser is random or unpredictable, if he's abusing different people on public places, if he's abusing people even at work, then it can be thought that, okay, mental illness is the underlying cause in his case. Mental health issues are more likely to result from domestic violence. Women who experience domestic violence have higher rates of mental illness. 64% experience post-traumatic stress disorder, 48% have depression, and 18% attempt to commit suicide at some point in their life. If we talk about the impact of domestic violence, I'll just divide into impact on health, which is both mental and physical health, impact on the family, which includes impact on children, and impact on society as a whole. 75% of cases of domestic violence result in physical injury or mental health consequences. It also results in self-harm and attempted suicide. 1/3 of women attending A&E for self-harm were domestic violence survivors. And I've seen loads in my practice, and I was like, oh, so she's suffering from domestic violence, but she's just scared to speak about it. It also results in self-harm and attempted suicide. 1/3 of women attending emergency departments for self-harm were domestic violence survivors. Abused women are more likely to suffer from depression, anxiety, psychosomatic symptoms, eating problems, and sexual dysfunction. Violence may also affect their reproductive health. Unfortunately, 30% of domestic violence starts in pregnancy. It has been identified as a primary cause of miscarriage and stillbirth. Domestic violence is also a major factor leading to death in or related to pregnancy and stillbirth. During the year 2006 to 8, 34 of the 261 women who died around the time of giving birth showed signs of domestic abuse. 11 of those have been murdered by their partners or other family members. Impact of domestic violence on children, at least 750,000 children a year witness domestic violence. children who live with domestic violence are at an increased risk of behavioral problems and emotional trauma. Domestic violence causes a chaos in the society. 42% of all women and 4% of all male homicide victims were killed by a current or a former partner in England and Wales in year 2000 to 2001. Domestic violence was found to be the single most quoted reason for becoming homeless, which was found in 46% of women. Nearly 1 in 5 counseling sessions held in relate centers in England mention domestic violence as a problem in their marriage. If you look at this graph, the number of people injured by domestic violence is 70%, which is far more than the people injured by acquaintance violence, stranger violence, or mugging. The cost for treating domestic, when I was reading these figures, I was just surprised because it causes 1.2 billion per year, which is 3% of NHS budget. The cost of treating mental disorders due to domestic violence is 176 million, and the overall cost of domestic violence is 15.73 billion per annum in the UK only. Is there a solution to domestic violence? Before we find the solution to domestic violence, we need to discuss our attitude towards domestic violence. A study was done on young people, and it was found that nearly a quarter of young people living in Wiltshire believe that sometimes abuse is okay, while 1.4% said that it was always okay to be abusive in a relationship. That's very strange. And this is consistent with an earlier study which found that 1 in 5 young men and 1 in 10 young women think that abuse or violence against women is acceptable. Besides attitude, another problem is that domestic violence occurs behind the closed doors. So there should be a way of getting the people out of their homes and to talk about domestic violence. Healthcare professionals, doctors, and midwives are the first point of contact. So, should there be a routine screening for domestic violence? If yes, how often? What are the risks and benefits of doing domestic violence on a regular basis in a GP setting? There hasn't been a single study that strongly suggests that there should be a routine screening. However, a pilot project in Leeds found that routine inquiry about domestic violence in maternity settings is accepted by women, provided that it is conducted in a confidential environment. Doctors and midwives are being trained for the signs and symptoms of domestic violence and to report if found any. We can discuss this topic for days and days, but the message for today is speak out and stop domestic violence. Thank you very much.